Direct services staff of a provider agency must be at least 18 years old, have a valid Social Security number, and one of the following forms of identification: State of Ohio identification, valid driver license, or other government-issued photo identification. This determines staff eligibility. Direct service providers must have a high school diploma or general education diploma, GED, and be able to read, write, and understand English at a level sufficient to comply with all requirements set forth in administrative rules governing the services provided. Upon hiring, the agency can assist new direct service provider staff to successfully complete required training. Provider agencies are responsible for ensuring that staff complete required training and background checks. Staff must also be enrolled in the Retained Applicant Fingerprint Background Check, better known as RAPBAC. Staff must also hold a valid certification from the American Red Cross or equivalent in first aid and CPR, including an in-person skills assessment. 8-hour providing training required. Before providing services to a person with disabilities, provider agency staff must successfully complete 8 hours of training that includes the following topics: an overview of serving individuals with developmental disabilities, including implementation of individual service plans, the role and responsibilities of direct services staff for services including person-centered planning, community integration, self-determination, and self-advocacy, universal precautions for infection control, including hand washing and the disposal of bodily waste, the rights of individuals set forth in sections 5123.62 to 5123.64 of the Ohio Revised Code, and the requirements are known as the MUI rule, including a health and welfare alerts issued by the department. Before staff are approved to provide services to a person, the staff must also successfully complete training specific to each person they will support. That includes what is important to the person and what is important for the person, the person's specific support, behavioral support strategy, management of the person's funds, and medication administration or delegated nursing as applicable. Additional training requirements may apply for some services. Annual training required. Provider agencies also ensure that their direct service provider staff complete annual training, including requirements as outlined in OAC 5123-2-2-01, provider certification, including the following topics: the role and responsibilities of direct services, including person-centered planning, community integration, self-determination, and self-advocacy, the rights of individuals set forth in sections 5123.62 to 5123.64 of the Revised Code, the requirements of OAC 5123-2-17-02, better known as the MUI rule, including a review of health and welfare alerts issued by the department since the previous year's training,